Hello, my name is Pamela Cipriano. I am a doctorally prepared nurse practitioner at the Practice of Health and Wellness. It's a solo practice in Thomaston, Connecticut. I've been doing some videos on Lyme disease and chronic urinary tract infections, also chronic inflammatory problems. I trained under Richard Horowitz in Highland Park, New York. I also trained with nurse practitioner Ruth Kriz for the chronic urinary tract infections. I've been doing some videos on the treatment options for those things, and recently I decided to really talk about personally what I've gone through with my health so that you don't feel like you're all alone. My first one was about something that happened to me when I was 26. This one's going to be about something that happened to me when I was 37. And this one really affected me even more so than the mini stroke I had when I was 26 years old. So when I was 37 years old, take that back. When I was 34 years old, I started developing profound fatigue. It felt like somebody unplugged me. That's the best way I could describe it. I was so overwhelmed with fatigue, I could barely get out of bed. And it kind of happened all of a sudden. It wasn't like a slow progression to this. I've worked out since I was a teenager or even younger. And just to do some kickboxing would just make me almost pass out. I could barely do that. I started gaining weight. I started losing weight. I could literally gain and lose 20 pounds in a week. Started losing my hair. My memory was literally shot. I remember being at a meeting and my boss had asked me to do a presentation on a research study. And when I showed up at the meeting the next time, didn't even remember him asking me or giving me an assignment. It was crazy. It really was. I thought I was going through an early menopause. I was having really severe hot flashes where I was breaking out in a sweat. It was horrible. I went to a total of 4 primary care doctors. I saw a cardiologist and I saw a pulmonologist, and no one was able to help me. No one. I think the only reason they didn't say it was all in my head was because I had such physical changes to myself. You know, the weight gain, the hair loss, and things like that. My blood work was all completely normal. I had a chronic cough that just wouldn't go away. And I kept telling anybody who would listen, I felt like I was being choked to death. I felt like I couldn't breathe, and I kept pressing right here. Not one person put their hands on my thyroid, but my thyroid levels were normal. My mom died of lung cancer when she was 59 years old. And I was concerned that maybe there was a genetic predisposition to this. And so the doctors did do chest x-rays and everything was completely normal. So after a while, I ended up on short-term disability from my employer because I could barely breathe. I could barely talk and I could barely walk. In my mind, this wasn't going to end well for me. I had everything in order because I thought for sure I was going to die and leave my children without a mother. It was heartbreaking and frightening, but I think my biggest concern was that they had enough money and I did have a good life insurance policy. And so that was the only thing that was actually allowing me to die in peace. It sounds terrible to say, but my biggest concern was their future. Their father was trying to keep their mind off of my illness and doing other things with them. So I don't think they really realized how sick I was at the time. I finally got to a point where after 2.5 years of this is how long I was sick for. After 2.5 years of this, I realized one day I was going to end up in the hospital. And I had been staying on the couch in our downstairs. We had a finished basement because it was easy to get on the couch and off the couch. The way it was designed, it elevated my head because I was snoring so badly as if I had an obstruction. So this was a little bit easier for me to sleep, and I wasn't snoring as loudly. I eventually ended up in the hospital. My 13-year-old son had found me passed out in the shower and first called my girlfriend who I had graduated from nursing school with, and then called 911. When I got to the hospital, I was put in the intensive care unit, and a bunch of tests were done. I had an anion gap. Anybody in the medical field knows how serious that can be. And a CAT scan was done of my chest, and that's when it showed it was my thyroid. So rather than have a butterfly shape on the outside of my neck, it was actually growing inward and was blocking off my trachea. So when I was telling everyone that felt like I was being choked to death, I literally was being choked to death. If I hadn't passed out, I'm not sure how much longer I would have lived, to be honest with you. It was that severe. I think my biggest issue with that whole fiasco was I couldn't seem to get any of the doctors to really hear me. I don't think they really heard me. I don't think they heard how much I was suffering with not being able to breathe. That was one thing. Another thing that happened was that the cardiologist I went to, I knew for years. So he trained me in the coronary care unit. So he knew me when I was a brand new nurse in my late 20s. He knew me when I got into sales because he was one of my customers. So he knew me for a good 15 years. I would have expected him to notice the changes of my physical features more than anybody else. And when he trained us to never only focus on the heart because it was a coronary care unit, but to make sure we looked at the entire body. So when I did get discharged, I did keep my follow-up appointment with him just to let him know how disappointed I was in him. I was disappointed because everything he taught us, he did not follow. So the only thing he looked at was my heart. I went to him because the simplest thing like folding laundry or going from a sitting to a standing position would skyrocket my heart rate to the 150s, 160s, 170s. So I was going into SVTs, and then I really couldn't breathe. So rather than try and find the root cause of the reason for that, he put me on a beta blocker, which I already had hypotension, which just caused me to pass out. So I had to come off of the beta blocker. When I was done telling him how disappointed I was in him, he could say any other way, he took it like a man. He really did. I think if he could have, he would have ran out the door because I was very stern because I was so disappointed. And the only thing I did say to him when I left was that I hoped that this helped him to be a better doctor to his other patients. So I really think when a patient confronts you like that, in my personal opinion, it would definitely change the way I practice medicine. The second thing that happened to me was when I went to see the pulmonologist because my sats were low in the primary care doctor's office, and I was having such a difficult time breathing, could barely get out an entire sentence. He did a pulse oximetry in his office. So he had me walk around his office with a pulse ox on my finger. And by the time I was done, my sats were in the 60s and my lips were blue. And his diagnosis was I had anxiety. That was his diagnosis for me. So here I was literally dying, being strangled to death. My thyroid wasn't somehow functioning. It was growing inwards, and his diagnosis was anxiety. Any woman who's watching this video knows what it feels like to have something serious going on and having the provider tell you it's anxiety. I can guarantee you if I were a man, he would not have been diagnosed with anxiety. I can guarantee that. So clearly, I never refer anybody to that doctor. While I did have my thyroid so crazy, I was having panic attacks. I was having anxiety. I never had anxiety like that before. My heart palpitations were causing some of the anxiety because it was so rapid. When I went to see the endocrinologist after they discovered it was my thyroid, she did a biopsy on a very small nodule I had, and it was an incidental finding that it was cancer. So it was a kind of cancer that would never have killed me. It was papillary carcinoma. The fact that I actually had a cancer in my body was frightening, to say the least. They gave me the option of taking out half the thyroid or taking out the entire thing. And after everything I went through with this thyroid, I said, I want the whole thing taken out. So when they did take out the thyroid, they did send it to pathology, and they did confirm that I did have a very small 2 millimeter papillary carcinoma. The endocrinologist is the one that, one look at me, and she said that I had thyroid issues. So she took one look at me. Unfortunately, I didn't see an endocrinologist while I was that sick. She started me on Synthroid immediately, and I immediately felt so much better. Like somebody plugged me back in again, is basically how I felt. And when I had the surgery to have the thyroid removed, and everyone was concerned about my airway, oh my God, it was like somebody roto-rootered my throat. I couldn't believe how well I could breathe. I was ecstatic, and I knew I was going to live. So that was the most wonderful feeling I can possibly explain when you have 2 small children at home. That was absolutely frightening. What happened to me afterwards was something I didn't expect. To this day, I'm 61 years old now. To this day, when I get sick, when I had COVID, when I've had the flu, when I've had bronchitis, anything, I panic. I literally panic. I think it brings me back to that point when I was so sick for 2.5 years, that chronic illness I had for that length of time really affected me. When I tell you I do everything possible not to get sick, I am not exaggerating. And unfortunately, I'm one of those people that when I get very stressed out, my immune system drops and I get sick. When I get a patient who has a chronic illness, I know exactly what they're going through. I know exactly how they feel. And I try and listen to every single patient who comes in my office, because I personally know what it feels like not to be heard. I mean, in 2.5 years, I went to 4 different primary care doctors, and not one of them listened to me. Not one of them heard me say, I can't breathe. I can't breathe. I feel like something is strangling me. I can't breathe. It was horrible. It was the most horrible thing that's happened to me to this point in my life, health-wise. So when you come to my office, I can promise you, I am going to hear what you say to me, because I've been you, and I know what it feels like to have something going on in my body that nobody can figure out, and nobody was really trying to figure out, let's face it, and nobody was listening to me. That was the most upsetting thing ever. When you have a chronic illness, whether it is Lyme disease or another tick-borne disease like babesiosis or Bartonella or tularemia or brucella or Rocky Mountain spotted fever or Q fever, there's a number of things it can be. Or you come to my office with chronic urinary tract infections that you just can't seem to feel better, or you have chronic mold exposure, or you have heavy metal poisoning, or you have food allergies that nobody even realized you had, or you have chronic inflammation throughout your entire body. I know what it feels like to go to so many different doctors, and they're literally just going through the typical type of illnesses that they see on a daily basis, and they're never going to diagnose you correctly, because what you have is not something that they see on a regular basis. Even the specialist didn't diagnose me properly. The pulmonologist diagnosed me with anxiety, and here I was suffocating to death. This did not happen to me, but this has happened to a number of my patients. When a provider gets aggravated with them because he or she is saying what they think the patient has, and the patient is arguing, no, that is not what's happening. I have had patients tell me that the provider says, who's a doctor here? If you don't want to go by what I'm saying, there's the door. You know what I tell them? then there's the door. And walk out and never return to that provider again. We're human. We make mistakes. Let's face it. But unfortunately, in the United States, at least in Connecticut, providers aren't looking at the entire body. They're just not. I don't understand where the disconnect is. It's one body, one whole body. It's all connected. But we have a specialist for every single possible part of our body that nobody actually looks at the whole thing anymore. The old time doctors did. They definitely did. Something happened. I don't know where the disconnect is. I don't know if it's because I'm a nurse. I don't know if it's because I was a patient. I don't know if it's because I've had chronic illness. I don't know if it's because my son had Lyme disease and was misdiagnosed for 10 years and I finally diagnosed him correctly. I don't know which one it is that caused me to be a provider that looks at the entire body and will find the root cause of your disease process if it takes me the rest of my life. Because I'm not going to let you down. Because I know what it feels like to be let down and literally be left to die. If I didn't get to a point where I had to climb 2 flights of stairs to get to the upstairs bathroom to take a shower and passed out because I had no oxygen left in my body, and my son didn't come home when he did and find me in the shower, the poor kid was only 13 years old, and called 911, I wouldn't be here today. I totally would not be here today. Because I was so mismanaged and so misdiagnosed. If you feel like you are living what I'm describing, please call the office. It's the Practice of Health and Wellness. The telephone number is 860-880-2525. Our website is thepracticeofhealthandwellness.com. This is my second video explaining what I went through with a health issue. And there's more to come. I have had quite a life with health issues. But the first one with the mini stroke and this one with the thyroid were definitely the ones that really rocked my world, I have to say. I did not think I was going to survive this one. I really didn't. When I do go down that rabbit hole, when I'm getting myself so depressed because it's bringing me back to a time when I really thought I was going to die, I do a lot of positive thinking. I do a lot of prayer. I do a lot of manifestation. I do a lot with the universe to try and turn things around for me. And I have a son, the 13-year-old is now 36, on his way to be 37, who is an amazing person with an incredible ability to really, really pull me out of that rabbit hole and help me to remember all the positive things in my life. Because when you're that sick and you're that stressed, you honestly can't remember one good thing in your life. It's a terrible situation, it really is. But I want to tell you, you're not alone at all. And as I said in my last video, my younger son is the clown. He really is. He just makes me laugh until I get to a point where I'm no longer sad. If you have people like that in your life, thank God for them, because honestly, they're the ones that have been keeping me alive all these years and laughing and hopeful. I am Pamela Cipriano. I'm a doctorally prepared nurse practitioner. I have a solo practice in Thomaston, Connecticut, the Practice of Health and Wellness. I really hope you take the opportunity to look me up. See me on my Facebook site, YouTube, and my website. Take care and stay healthy. Bye.